everyone. Thank you for being here. I'm Dr. Lisa Boyne-Sindas, and my co-host
is Dr. Kiana Nix.
Awesome. We are Carib Nation Health. So I'm just going to go right forward because we are very excited. We really want to get this information out to everyone. And I know it's been in the news, but we wanted to clarify it, right, Dr. Nix?
Yes. And what is our topic today?
Yes. Okay. Our topic is we're going to discuss MISC, which is multi-system inflammatory syndrome in children. It's a new disease, and we need everyone to know about it. It's rare. It's not a lot of kids, but we want to be proactive and preventative and get the word out so that you can be aware of what to look for.
Right. Yes. Right. Definitely. Because we are really, really concerned, especially as pediatricians, about this multi-inflammatory systemic syndrome in children. That is new, and we're hoping that moving forward, we can be proactive and, take care of our patients.
Yes. So COVID-19 started in 2019, and originally we were told, okay, the kids were safe, and most of the kids would not be affected. But they did tell us that kids may be asymptomatic carriers, meaning, they had the virus some kind of way, but they were just going to exhibit very, very mild symptoms. And praise the Lord, none of our children would die or anything. Thank God. And that has not happened. But now we are seeing a COVID-19 related illness in children called MISC, multi-inflammatory system syndrome in children, also called PIMS in some countries, which is a pediatric inflammatory multi-system syndrome. And it presents children similar to a known disease of young children called Kawasaki disease. And Kawasaki disease is an illness caused by an infection or maybe a genetic predisposition, which causes vasculitis. What is that? Inflammation of blood vessels and a possible damage to organs that it affects. So this new illness was noticed in UK, which prompted physicians to contact each other and all their colleagues all over the world to be aware of this illness. And cases have been found in Europe, New York City, and some states in the US. And thus far, the combined data has shown that the disease started in children about 1 month after they were exposed to COVID-19, or exposed to persons who had the illness or persons who were exposed to the illness. So we're going to talk further about this today. So, Dr. Nix, your first question is, what is Kawasaki disease and how does it manifest in children?
So Kawasaki disease is an inflammatory condition that is usually seen in children under 5 years old. And as you earlier discussed, the cause could be genetic or it could be an infectious related illness. So basically, we're worried about this condition because of its effects on the heart, the coronary artery. The coronary artery is the large blood vessel in the heart, and it can lead to dilatation, which is known as the coronary artery aneurysm, which can lead to rupture. So that's why we're worried about it. And in children who are affected by Kawasaki disease, the findings are usually conjunctivitis, bilateral conjunctivitis, which is redness of the eyes. You may find a rash, desquamating rash. You can find redness of the hands and swelling of the hands, and a rash also of the soles of the feet. You can see lymphadenopathy, which is, some people call it just a swelling, which is a swelling in the neck, which is lymphadenopathy, right in the neck. And children can also have red appearing strawberry-like tongue. So, and of course, fever for greater than 5 days. That's one of the main things, the main clinical finding.
So as we continue to discuss, what is MISC or PIMS, and how is it different than Kawasaki disease in children? As we said, Kawasaki disease is something we have known about as pediatricians, and it's rare, and most kids get over it. They get hospitalized and they come out of the hospital. They get hospitalized and they go home healthy and well again. But with the MISC, the children appear to look like they have Kawasaki disease with some differences. And those differences include a more severe picture, more like a shock kind of presentation. They're more sick. They have more signs of body function. When you say shock, the body is not functioning well, it's failing. So that they have the similar rash as Kawasaki, but there's more risk of thrombi or in the blood vessels. And we also have more effect on the heart. So in addition to the vasculitis, inflammation of the coronary arteries, which are the arteries of the heart, we also have now with MISC a risk of heart failure or heart attack, because it can cause inflammation of the heart muscle, myocarditis or pericarditis of the lining of the heart. So the heart muscle is affected. So those are the main differences. The similar rash, pink eye, persistent fevers, but it's a little more severe heart issue. And in addition, they present with major abdominal pain. So fever and abdominal pain with nauseousness, vomiting, and diarrhea. Any kid with fever and stomach ache, we are always worried, right, Doc, about appendix.
Yes. We're always worried.
Always
so don't
worried.
forget, don't forget is that they have GI, gastrointestinal symptoms. So with a fever, and if they're exposed to someone with coronavirus, COVID-19 disease, or were exposed to someone who's positive for the virus, the SARS-CoV-2 virus, then there is cause for concern. That's right, Dr. Cinders.
So in addition, one other point, they usually have antibodies, positive antibodies to COVID-19. So that's why people are now compiling the data of the cases and saying that they most likely were exposed 1 month prior to the illness or presentation of the MISC picture that the kids come to the doctor with.
Yes.
And fever, severe abdominal pain, Shockey-like syndrome, and risk to the heart for heart failure.
So our third question is, are there a specific demographic affected by the MISC or PIMS, multi-inflammatory systemic syndrome in children? So the answer is yes. So the findings from the UK and the New York study, they noted that it was more common among blacks of African or Caribbean descent. And they found that those are the same findings they noted in New York and in the UK. So of note, most of the other things that they were looking at is if there were comorbidities. Mm-hmm. So they found that in general, though, there are no comorbidities. Most of these children have no underlying condition. But if you have obesity and asthma, then your risk is higher of getting this multi-inflammatory systemic syndrome in children. So the answer is yes. Answer to that question is yes.
My fourth question is there a treatment for MISC, and if so, what is the treatment? So at this point, it's being that it's similar and Kawasaki-like, they have continually been treating the patients with, you must be hospitalized for this treatment. It's not an outpatient treatment. So you'll be in hospital, you're provided with the fluids to deal with the Shockey-like syndromes, and anti-inflammatory medications are the key because it's an inflammation problem. And those anti-inflammatory medications would be, of course, most likely IV immunoglobulin, aspirin, and steroids sometimes if you're not responding to those things. In addition, you might need a blood pressure medications to deal with the heart issues. and monitoring in the hospital by a cardiologist who will have to do an echocardiogram. Echocardiogram is like an ultrasound of the heart. So you can look at the chambers and look at the blood vessels and look for the aneurysms or widening or dilatation of the coronary arteries, and look for the evidence of heart failure in the muscle of the heart and pericarditis or inflammation of the heart. So those are the main treatments. Most children with Kawasaki go home fine, and then they'll have long-term follow-up with their cardiology. And at this point with MISC, they're treating them quite similar, and that's basically the treatment.
Okay, so our fifth and final question, what are the long-term effects and if follow-up is needed? So you kind of touched on it, you did touch on it, but yes, again, just to reiterate that we are really concerned about the long-term effects on the heart, right? But yes, we're concerned about the long-term effects on the heart, but don't forget, you know, children can also be mentally and emotionally stressed about this, you know, when they're ill in general anyway. So that's also, yes, that can also have a long-term effect on them. But in terms of cardiovascular wise, they will have coronary artery problems. So with the coronary artery problems, it leads to dilatation. That is what we call the aneurysm, and then we're worried about that because it can lead to rupture of the coronary artery when it's weakened when and it gets larger. The muscles get weak, so that's why the likelihood of rupture is higher. And that's why a long-term follow-up with a cardiologist is needed. Now, according to your findings upon discharge, then their follow-up will be, you know, based on the findings upon discharge, I should say, during your hospital course. So, and then by the time you see the cardiologist, they will determine whether you need a 2-month follow-up, a 6-month follow-up, but most kids are seen up to 1 year of 1 year after the diagnosis. But in general, your cardiologist will, like I said, once you your child is followed up, and they will determine how frequently that the follow-up is necessary. Another thing that they do, and Dr. Sin has also touched on it, that they will do an echo and an EKG, which is an electrocardiogram, which basically checks the rhythm of your heart. So that's because you can have conduction disturbance. And so the conduction disturbance or abnormal rhythm of the heart can be one of the long-term effects. And then infarction, which is the muscles can be affected. So then it will lead to myocardial infarction, which we all know is called a heart attack. So those are the things that we monitor our patients for, and those are the long-term effects. And not to forget that there's always, you know, emotional, so it's biopsychosocial effects on children. So
we didn't mean to cause any anxiety to our community. We really want to give you information and keep it in perspective. It's a very small amount of children. Of the 8 million people in New York, 147 children as of 19 had that. So it's a very small amount, and most children for Kawasaki types of illnesses recover. With the new COVID-19, we not sure exactly where it may go, but we're hopefully it will work out. And in the meantime, we just want to make sure everyone is aware. So we'll be coming back with a wonderful doctor, Dr. Astra Webb. Dr. Webb is going to help us discuss another issue inherent to COVID-19 as it relates to children, with the impact on our mental health, on our children's mental health. And Dr. Webb is the CEO of Healthy Kinder. She is a health and wellness professional who is certified youth and adult mental a First Aid USA instructor.
Welcome, Dr. Webb. Thank you
Thank
for
you.
joining us. So we have some questions for you.
Sure.
Go ahead, Dr. Sindus.
Yes, we're so excited you're here, Dr. Webb. She's such a leader in the mental health community, and she shares her love and devotion in helping people heal in mental health throughout the world. So we have some questions.
Okay.
And the first one is, I found this article from JAMA and Pediatrics that stated that 1 in 5 children in the home confinement report feelings of depression. So Dr. Webb, from your experience, how do you feel social distancing, the physical distancing, and quarantining has affected children of different age groups during this COVID-19 pandemic?
So first of all, thank you for having me on. You guys are awesome in what you do as well. So thank you for allowing me to share my expertise on mental health, especially with our youth. And, I am so grateful that you are raising awareness to this issue. I think we have to look at the age range of kids, let's say between 3 and 17, and let's break it up from there. So, first we have the children, and those are the ones we would consider between 3 and 12 for our discussion. And then we have the adolescents and the teens, right? So 13 through 17. So I'll take them by categories first, because I think the mental health issues are different depending on the age group we're dealing with. So first of all, with the children, the younger age group, there is still 2 groups of kids that we're seeing manifesting mental health issues different. The first group is the one that's actually showing an improvement in their mental well-being. And here's why. I know that's a shock, but here's why. First of all, we have some children who usually have to get up early every morning, go out on a routine, sleep for hours or long time in the car, rush for breakfast, so the parents can drop them to school and then get off to work. And now they're pretty much on their own time. I can get up at a more decent time, don't have to worry about being on the road. And of course, for the parents who do both before care and after care, of course, it's even more difficult. So there is a certain amount of mental release, and even just doing those activities for some children as young as 5 to 5 years old, that could be fairly stressful. So they are receiving a release from that. In addition to that, there are some kids in this age group that suffer with a tremendous amount of separation anxiety. So just to be home with their family members, it takes that anxiety away.
More hugs and love.
Yeah, more interaction.
Absolutely. And then you have the group of kids who may be bullied at school. So these are the children who no longer have to take the school bus or find an excuse. I'm not feeling well today not to go to school, because they won't have the issues of bullying. So, we can't assume it's negatively impacting every child. I think that's the first thing, right? But I think it is a critical time for us to understand that those dynamics are important for kids as well, social bonding and so forth. So this social distancing and quarantine for this first group has been wonderful, a great experience. And those are the kids who actually we find them engaging, actively learning through different ways, because their parents might be working, so they have more access to gadgets. They're learning different things. They get the time to go outside and play outdoors, because if the parents need a break, they take them with them as well. So there are some good. But I want to switch to now where we find the majority of the kids today. And this is where in this early age group. And these are the children who we really find in marginalized communities, and communities of where there are lack of support for mental health services. So that's really important to note. And most of these are the kids who don't have access to social media or gadgets within the home, or poor Wi-Fi or no connectivity at all. So they can't even get online and join their friends and so forth. These are also kids who live in a very tight, confined space with adults and other siblings of various ages. And so it's very difficult for them to self-isolate. They don't have the peers necessarily. Actually, there are more arguments, fussing within the household. They're subjected to hearing a lot more domestic violence type issues. They are the children who are more easily physically abused because the amount of stress, frustration that the parents are exhibiting. And then, we see there's also bullying within the households, issues of, not just physical, emotional, verbal, but also sexual abuse, especially in the families. And we all know the perpetrators tend to be the ones who are closest to the kids, right? And so with the increased use of alcohol and drugs in the house, we're finding more and more issues of abuse. And so we have to pay attention to that with every child and really understand. It's easy to say sometimes to these families, well, the kids need to go outside and enjoy the fresh air. But when you're in a confined community, for example, in public housing, where there's no play space or the space may not be perceived as being safe, right? Because there is an increase of drug activity and so forth happening in these times. So some parents pretty much lock down the kids in the home. And as a result, that anxiety, that worry will continue to rise. And then, so that's, overall, that's what we see with the children. And then when we look at the adolescents and the teens, whole different category of young people, because what's important to them is social connection. And with the changes of social distancing and quarantining, they no longer have that opportunity, right? Freely. Many of them, they depend on, this is the age in which they bond more with their peers more than family members. So to be home and quarantine with your parents is, for some kids, that's just not, for teens, that's not cool, right? That's not a cool thing to do. But during this adolescent development, we know that the prefrontal cortex of teenagers are not fully developed, which means their ability to reason and rationalize doesn't really exist, or is very limited.
So no matter what parents say, they're gonna do.
Yeah,
correct.
That's what we learned during residency.
And then, so we know, one, that's a stage of development, but then we also recognize that these children aren't, their norm has been swiped from them. So the way they perceive this new normal is inconceivable. They really just can't get the grasp on it. And as far as they're concerned, they're just trying to figure out when the school opened. Now we're coming to the end of the school year. And socially, so many kids haven't had graduations, end of year class trips, or last day of school. No more friends signing their t-shirts, autographs, fun pictures. Some of these kids are going on to the next phase of their lives, so college, right? So they are losing all of these social memories that they all dreamed of, graduating from high school or graduating, from college if they're super right? So socially, they've lost so much. So there's a lot of disappointment on top of anxiety and the depression. And then we're finding that these teens are increasing their use of drugs, alcohol, marijuana, vaping, because they're bored, nothing to do. And so that is what, these are adding to those mental health stresses, because it's a comorbid kind of picture, right? So our challenges for our teens, we have to recognize that social connection is very, very important if you're going to deal with it, resolving them and moving them forward to recovery and their mental health issues, right? So these are just some of the very differences that we recognize between the children and the teens and adolescents.
Well, thank you for answering those. I really noticed that. I was like, we really, it's in a defense for the need for sleep. children because
Yes.
I always see them tired, and we try everything, tell the parents put them to bed earlier, get away from the screen time because of stimulation of the brain, but sleep is a major factor in mental health.
Absolutely. In fact, it's a sign
Mhm.
that the child may be struggling because they're going to sleep too much or sleep too little.
Mhm.
So, definitely that's important. I mean, even if you try to think, what are they doing all night? Some kids, they may just be on the gadgets, but there are others who are avoiding the abuse, the yelling and screaming in their house,
Hiding out.
the neighbors,
Mhm.
So we can't always assume every child is just not sleeping because they're not. We really need to try and figure out if there are other social issues that are happening in the home that might be, creating this lack of sleep. And of course, they all come in the mental health spectrum, because if there's any form of abuse, domestic violence, so forth, we need to be able to address that. Sometimes parents themselves get frustrated and angry and anxious, and they take it out on the kids, we
Yes.
transfer it,
True.
which is wrong.
That leads to Dr. Nick's.
Yes. So my next question, Dr. Webb, is parents are struggling at home. This is perfect question for what you just follow up for what you just said. So parents are struggling at home, being a super mom or a super dad, teleworking. Some are teleworking. They're trying to manage to cook 3 meals or more per day and feed up their kids with snacks, trying to organize the kids' schedules for remote learning, remote activities, Zoom graduations, music or sports training, leaving or which is, well, these things are leaving our parents and caregivers very stressed. A study in family psychology found that parents may transmit this overwhelming, suppressed stress to their children, which can affect them in many ways. So how do parents avoid holding on to stress so they can help themselves and their children?
Okay. So, first of all, I think it's important for parents to find their own self-care strategies. I think we need to identify, do we have underlying mental health challenges? I mean, it's expected. And the truth is, nobody's doing this alone, right? So we have to recognize that, because if we don't, we're going to just keep transferring it onto the children without recognizing it. And yes, we have parents who have now had to multitask in so many levels that they themselves are so overstressed. So my suggestion is to any parent is, let's look at a list of priorities for each day. Literally start each day with a mini list, and you're going to have 8 to 18 different things to do. The question is, what are my top 3 that I have to get done today? And let that be okay. Whatever has to default, the next day you might start your list, and depending on what happens during that day, you may have to reprioritize. It's not the same 3 you had, but find make sure that you take care of 3 activities and just let the rest go. We have to learn how to release, because we're not machines. We are human beings with emotions and feelings. We will get burnout. We will get frustrated if we don't learn how to do work. We're doing work, life, family balance now.
We have to say an amen for that.
That's right. Right?
Yeah.
And as moms, especially, our single mothers, we don't take care of ourselves. Everybody else comes first, right? So we take care of the kids and the meals and so forth. But we need to start paying attention to our own mental well-being, because if we mentally shut down, nothing moves. And we have wonderful fathers who do step up to the plate. By design, we tend to be more resilient to getting more done in a short amount of time, just because of routine over the years. And I know, because you have a Caribbean audience, I can actually say something like that, right?
Yes.
But we do have to take that time to set back some time for ourselves. So we have to identify if we have mental health challenges. And then the second thing we need to do is figure out, is this something I need to share with somebody else? So whether that's a family member, a best friend, or even a professional, you really have to evaluate, is this a stress or anxiety or depression such overbearing amount for me right now that I need to speak to someone and share with it. Because even with family members and friends, there are people who will pray with you or encourage you, or
Yeah.
right. We need that because we're in this together. Basically, no one's alone. And then the third thing we need to do is for that parent is really identify what kind of self-help strategies can I have for myself. I mean, right? Is sometimes it's very difficult to self-isolate during a quarantine, or if you're shut down, depending on the number of individuals within your home, the size of your home, and of course that's a challenge for many families. But if you can't do it yourself to get away, then the whole family is going to do yoga, or we're all going to do Zumba, or we're all going to listen to music and just move around and exercise and shake something, because there's no other way around it. But we have to take a moment away from the computer doing work, away from the routine from helping kids with schoolwork. I mean, it's coming to an end now because we're going into summer. But, worst case scenario, if we do see a second wave and this continues to be the norm in fall semester, at least parents can get into routine of how do we take a break, right? So these are some of the things to help those parents and understand we're human beings, we're not machines. So we have to start to learn how to let go of things we can't control.
So, it's so funny you said something about dancing and Zumba and yoga together. I mean, I love Zumba, by the way. I'm certified to teach Zumba. But yes, I love Zumba. But just this week, I think it was Tuesday, I posted on my social media pages that, if you're a parent at home, if you get some time, play some of your favorite music. Play your soca music, your reggae, your dancehall, or replay the clash that you just saw between Beanie Man and Rose Taylor. That's it. Have some fun.
Okay, fun. Yeah, while you're doing the dishes.
Yes, while you're doing the dishes, yeah.
Music and dance right there.
Yeah.
And what I think is so funny, sometimes I hear my daughter singing our oldies but goodies. I was like, what do you know about that? She's hearing it from shows they're playing over and over and over again. And it's just amazing to hear them sing the songs of our era and our time. I say, yes, but I can't tell them because they'll think, Mom, you're not cool.
Let them sing it. Let them go along. Let them just stay on.
Cool to their parents. They just won't say it, right?
Exactly.
Yeah, I know about that, but yeah, okay. I can't say anything, right?
That's right.
It's really nice.
Yeah.
So I think the next question is for you, Dr. Cindy.
Yeah. So, what can we do to help the children during the social disconnectedness and social interaction with their peers and their grandparents? So we have talked a lot about, I think a lot about this question, but just specifically now for the children who are feeling, oh man, I really want to go hang up on my grandma or my favorite auntie, because that's like my getaway. A lot of kids have a favorite auntie or the whoever the sugar mama, the sweetest auntie is, who has all the kids go by her house and spend Saturday night, and mommy always says it's okay.
Right.
So they miss those little getaways. So what do they do for blooming? But I hope they're okay.
And you're right. And I think mentally for so many kids, especially the younger ones, this is a huge problem. That human contact, the hugs, birthday parties are never the same, right? Get-togethers, long weekends. We can't even go visit family members anymore, right? Some of the kids are looking at, summer is coming up, vacation time. But then the reality is there probably isn't. It's a staycation, right? For many of the kids. So they're missing that personal touch. So it's really the responsibility of the parents to be really creative. So first of all, we have to think, what kind of fun, creative things can we do to replace the activity that, where we used to go out and visit family members and friends? Maybe we need to get into painting a picture for grandma to be able to send to her, or writing cards and letters. We grew up with pen pals, right? Snail mail.
Pen pals.
Exactly. It was That's right. It wasn't a 2-second email, hit send, and you go on, right? So now it's an opportunity to really bring back the older ways that we did things. This is the perfect
Yeah.
time. And teach kids who didn't want to pay attention to paper and pen. Now get them, journaling, writing. Those kind of things are very therapeutic as well for the children, and they get to fall in love with something that's new. The other day I wanted to take Solella out and I said, well, let's plant some flowers or plant some seeds, right? So without a teen really know you're trying to get them into something else, it's a great thing to do to get them outdoors, because a lot of our young people don't want to go outside. It's too hot. I don't want to sweat unless they're already sports gurus, but maybe in the cooler parts of the day, if you're able to go out and take a walk with the family, maybe that would be a great thing for the kids to do as well. But we have to get them to start looking at being more creative with some of the things they can do. And I urgently ask parents, let's not pull social media away totally from these kids. They need to be able to connect. So yes, we had to do it with education. But there's no reason we can't do Zoom meetings and get-togethers with family members or friends. You find a one set time, hour every other week, let's say, just so the kids can laugh, touch base with those that they love so much. And we find a lot of parents say, well, there's so much screen time. Well, then let's limit it. You can't be on the screen for more than 3 hours, right? So during this particular time, then we do other activities. Some parents may even have to put a schedule together. So just like you had the school schedule, well, let's have one for fun. I mean, we're going into summer. And the truth is, some schools want to start early because they've lost so much. So we have to kind of get them already in that program where they're ready to work. But we also need to teach them to use technology for positive things as well. For the teens, we're retraining that brain to think positive things and think hopeful things. So any activity that can stimulate creativity will be welcoming during this time.
Yeah, but even thinking back to our families in the Caribbean, some of them live in rural areas, don't have access to internet, or maybe they have a little stream or river running behind their backyard or something like that. That's a nice little place to go sit on a stone and meditate. That's something that we could even think of doing for some of our family members or Caribbean brothers and sisters in general, depending on the terrain of each respective Caribbean island, just find something fun to do. And like you said, planting of trees, yes, or planting fruits and vegetables, that's something that people can easily do in the Caribbean because of the weather, right? So great suggestions, Dr. Webb.
That's right. And I want to thank you, Dr. Nix, for bringing that up, about, using the outdoors that way. And I think that if we're going to stimulate this next generation to be entrepreneurial in their thinking, if you can figure out a way to use their natural resources through food and walks and natures and tours, it's a positive business. Maybe one day, sometimes these kids might discover a new trail. It could become a tour.
Oh,
new natural walk. I mean,
yes.
I'm going to tell you something that my family members did about maybe a month ago. They live in the north, up north. So they have a big backyard. They actually had a family 5K in their backyard and built an obstacle course. And they had different races. There are 4 kids and 2 adults. So among themselves, they just created their own 5K races. And the Melanie, she's what, 12 years old? She actually, her mom bought the equipment to make to print T-shirts. So she bought the T-shirts and she printed them, and she had her name on them. And then she had 5K on it, and they printed their own T-shirts for the 5K for that day. I think that was such a great idea
I love
for
it.
families to, yeah, I love it.
I could have gone.
Yeah, but they're like 6, 7, 8 hours away, so I could have gone too, but that's too far. So we
That's
have
awesome.
We
physically
should also
distanced,
think
but it's
about
family.
the teens that are studying this summer for their SATs.
Yes,
The CXC is
Yeah.
postponed, I think, to July.
yes,
And
yes,
this is major. So if we really have to think about them, they have to keep themselves focused. But in focus, there's added stress and pressure, and the community and their neighbors, and they're looking out for them. But we're gonna send them some prayers.
yes,
We
yes.
hope to keep themselves focused and mindful and meditate, like Dr. Nick said.
That's
Get
right.
their exercise and all that, because this is a big time for them during a COVID pandemic, you know.
Yes.
That's right.
So we have to big them up, and
Yeah, big them up. Yeah, you have just given us a wealth of information, and we just can't. We just feel like keep going on and on. But we just have one more question, if that's okay with you.
That's
So,
fine.
what is the best way to talk to your kids to deter them from becoming depressed?
Okay, very important question. Because one of the issues that we have right now is that parents just don't know what to do, right? Even if they recognize the signs. And the truth is, we have to let our kids know that the feelings they have, they're real, that they matter, and we can't dismiss it. We can no longer allow them to feel, because they feel hopeless or helpless, that you'll just get over it. That can no longer be part of our message. In fact, what we should be telling the kids and talking to them now and letting them know, the whole world is going through this together. Everybody is very sad, very worried, very anxious about, what's happening right now. And we have an uncertain future ahead of us. But we need to allow them to know what they feel. Other people feel it. Sometimes as moms, dads, aunts, grandmothers, we feel it as well. So it's okay to feel that way. But what we don't do is allow the sadness to rule our lives. Moving forward, we have to find a way to move, to advance. But in these times where we're seeing social and racial injustices, it's difficult as well for our children. So we need to have the conversations about those issues as well, right? They're sharing things with their friends on social media platforms, so they're seeing it. And we have to be mindful of exposing our children to all the bad news out there. Even during the news, the old-fashioned way is everybody sit around the table, sit around the TV and watch the news. We cannot do that when we notice that these kids are feeling depressed and anxious. We have to cut it back a little bit, because they go to sleep at night, they're concrete thinkers, and they dream it. And they think far beyond what it is. That could be me, that's my dad, that's my brother, that's my uncle, that's my cousin, right? They have so many questions. But this is the time we always talked about, the kids don't talk to us. This is the time to start conversations again. Even if you have to get at the table and eat together, have ice cream together, and let's
be surprised what they say.
Yeah, help. Yeah, we need to help them through this traumatic, time. I agree.
Or ask questions.
Absolutely. And then we have to teach them how to pray and meditate themselves. I mean, we pull that out as adults. We know how to do that, and especially in the Caribbean countries, right? We know, everybody knows about prayer and meditation. This is not, something you.
It's not novel.
This has carried us through life.
Yes.
Our grandmothers prayed with us and taught.
Oh yes.
In our genetics.
That's right. And we have to bring that back and teach our young people. Some of them don't even know, well, who is God or who is Jesus or what, they have questions. And this is the time. You have time now to talk to them. But you don't hammer them with a religious, practice. You talk about a relationship with God who loves us. We don't understand why this is happening. But we know that we were created for goodness, that everything terrible around us is supposed to work for our good. Yes. So though you can't prove it or show it to a child, just by us talking words of kindness, love, concern, and care. And as adults, we don't have to have the solutions for everything.
Yeah.
Sometimes it's good to tell them we don't know either, right? And let them know we feel scared sometimes. But we know if we pray together, families that pray together stay
together.
And no matter what, we're going to get through this together.
We will get through this.
Oh my
God. So thank you so much for sharing this. Oh, yeah. Thank you so much for sharing this wealth of information. We really appreciate you coming on the show, and hopefully this will not be the last time, because everybody's going to need a little mental health and wellness tune-up every now and again. And with all of what we were just talking about, don't forget we are available for virtual visits. I mean, there's telemedicine visits. You know, so if you need to talk to someone, don't hesitate to reach out to your healthcare professional, your physician. Absolutely. So thank you so much, Dr. Webb, for participating in the show. And over to you, Dr. Sinders.
Yes. Oh, let's just get Dr. Webb tell us where the audience can find her.
Oh, yes, please.
Sure. So you can follow, if you need to send me an email, you can feel free to send an email to healthykinder, it's like healthykinder, @gmail.com. But we're also, our presence is really on Facebook as Healthy Kinder International. So a lot of the programs that we do right now, we advertise that way. And you can continue to follow what's happening in the Caribbean. We've done a lot of training, raising awareness about mental health, helping people to learn the signs and symptoms, and really equipping them with the tools and the resources they need. And for all the Caribbean folks, please know that, you know, if you're struggling or you're not sure where to find your mental health services, contact your Ministry of Health services. A lot of them have resources, but most people don't even know they exist. So take advantage of that. And those of you here in the diaspora fighting with us, you know, our prayers are with all of us at this time. No one spared from the impact of COVID, from the sickness and the death and the dying. And we want to remember those who have lost loved ones.
Yes.
And, you know, who have loved ones now who's still fighting. Just let's keep hope alive and stay as positive as we can, because this invisible virus is not going to take us.
It's not going to take us out.
No, we will get through this. We have to get through this. We have to do this. We have to get through this together.
That's right.
Together.
Yes,
together.
So remember, for more information, you can always go to the CDC website to find out more about MISC. And again, your Ministry of Health for any mental health services, World Health Organization, Pan American Health Organization are all good sources for any of the information that we discussed today. We're so thankful Dr. Webb came, and she will be back.
Yes, she will be back.
Thank you, team doctors. I love it.
Yes. And we have like less than a minute, but until next time, I'm Dr. Sinders. I'm from Firefly Wellness Center. You can find me there. And this is Dr. Nix.
Yes, I'm Dr. Kiana Nix of RoDocs. That's Reliable Online Wellness Experience. Dr. Nix also provides direct access to pediatrics via telemedicine, www.rodocs.com.
You can find us at Caribnation and the whole Caribnation family, Caribnation TV, on Facebook, YouTube, Instagram. And thank you for watching.